Welcome, everyone. Thank you for your enthusiastic response to our Global Health Insights webinar series. It's a pleasure to see the participants joining us from different parts of the world. This response actually reflects the shared urgency of the issues we are discussing in this series. My name is Abdul Kalam Azad. I'm an assistant professor at the Jindal School of Public Health and Human Development at OP Jindal Global University. I also serve as the program director for MSc Global Health and Human Development Program. This is an online program primarily designed to prepare professionals to engage with complex and interconnected global health and development challenges, including the challenge of climate change. We are currently working with 55 students from 15 countries, and this brings together a wide range of professional and lived experiences to our discussions. Our next cohort will start in September this year. As part of this program, we aim not only to build conceptual understanding, but also to create spaces to have critical engagement with real world challenges. The Global Health Insights webinar series is one of such initiatives. Through this platform, we invite leading voices from academia and practice to reflect on global health issues. Today's session is focused on climate change and its impact on women and children. While climate change is often discussed in terms of environmental and economic consequences, its human dimension, particularly its disproportionate and unequal, also gendered impacts, require greater attention. And this topic is also personally close to my heart. I grew up and worked in Assam's riverbank and river island areas. I have witnessed the adverse impact of climate change on vulnerable population. I have seen how women and children displaced by flood and erosion face multifaceted challenges and how those affect their health and well-being. At the same time, we are also witnessing how the rising temperature and increasing heat stress are intensifying health and health risk for women and children in many parts of the world. We have seen reports like groundswell report where World Bank's this report estimates that by 2050 up to 216 million people could be internally displaced due to climate change. And this involuntary mobility of large number of people again will disproportionately affect vulnerable groups worldwide. And how do we respond to such big challenges? How do we ensure that policies and interventions are attentive to those who are most affected? And how do we bring together science, policy, and those lived experiences? And who could be better person to help us navigate these complexities, these questions, than our today's guest, Dr. Soumya Swaminathan. Dr. Soumya Swaminathan is a renowned pediatrician and leading global expert in tuberculosis and HIV research. She has over 4 decades of experience spanning clinical research, clinical care, public health, and global health leadership. She currently serves as the chairperson of MS Swaminathan Research Foundation. She is also the principal advisor to National TB Elimination Program and National Science Chair for the Anushandhan National Research Foundation. She previously served as a FAST chief scientist at World Health Organization and also the Director General of ICMR, Indian Council of Medical Research. During her tenure at WHO, she played a very critical role in coordinating global scientific efforts during COVID-19 pandemic and contributed significantly to advancing equitable access to vaccine, including through initiatives such as COVAX. Dr. Shaminathan is a fellow of the US National Academy of Medicine and the UK Academy of Medical Sciences. Her current work focuses on the intersection of climate change, health equity, and nutrition security, particularly in relation to women and children. We are truly privileged to have her with us today to share her insights on these critical issues. Before I invite Dr. Swaminathan to deliver her keynote address, let me also briefly outline today's format. So, following her keynote, my colleague Professor Sneha Krishnan will have a discussion, a moderated discussion with Dr. Swaminathan, and she will take questions from our participants. So I encourage all the participants to actively engage by sharing your questions and reflection through Q&A and chat feature of Zoom. So with this, it's my great pleasure to invite Dr. Soumya Swaminathan to deliver the keynote address. Dr. Swaminathan, ma'am, please go ahead.
Thank you. Thank you. Good morning, everyone. And thank you very much for this invitation and the introduction. So I would like to share some slides and then talk about today's topic, which is on climate and health. And while I will mention a few things that are happening globally, I think the focus is really going to be on India. And as you rightly mentioned already, Professor Abdul Kalam, that the impact is already happening. It is with us. We see it around every day and everywhere. And there's a strong possibility that these impacts will get worse. And therefore, we need to urgently start looking at the solutions and what needs to change on the ground, both in health systems, but also across the board, because this is clearly a multi-sectoral issue. It's not something that the health department alone needs to address. So let me start with the triple planetary crisis that confronts us today. While many of us speak about and hear about climate change, which of course is being driven by human activities and the greenhouse gas emissions, which have been increasing and increasing. But the other two aspects of the global planetary crisis really is air pollution, or all kinds of pollution, I would say, water as well as air. But I'm going to focus on air today because it's really impacting our health all around the world, particularly in low and middle income countries. And the third is biodiversity loss, which is much less well recognized, but is actually extremely serious because with the disappearance and decline of biological diversity, again, due to human activity, about 1 million species are threatened with extinction. Irreplaceable ecosystems like the Amazon rainforest or the coral reefs around the world are disappearing. And large amounts of wetlands like salt marshes and mangrove swamps, which used to absorb large amounts of carbon, have disappeared. In fact, the latest report on the ocean, which has been the biggest carbon sink for us, it is only thanks to the ocean, that the temperature rise has not been more. The ocean is now reaching a point where it can no longer continue to absorb heat and CO2, and the absorption of CO2 has led it to become so acidic that, again, many of the species in the oceans are vanishing, and that it will no longer act as a buffer. And therefore, we're reaching the point where there are many tipping points. And once you get to a tipping point, in fact, there are 9 planetary tipping points, and 6 of them we are either breaching or close to breaching. Once you breach a tipping point, it means that coming back is very difficult. So the reversal must happen actually before we reach a tipping point, because after that you get into a cycle which is very unpredictable. So we can say that the world as such is entering into a climatic cycle or a period where it's going to be highly unpredictable. Whereas in the last, several thousand years, we have been in a situation where the world's climate has been fairly stable. So we can see here that even over the last 50 or 60 years, the global surface temperature increase. The comparison is 1850 to 1900, which is called as a pre-industrial era. And if you look at the last few years, you'll see that the acceleration which is happening is even faster. Then we look at, I mean, I don't expect you to read this, but these are extreme weather events around the world. You can see that almost on a daily basis. In fact, in India, the Center for Science and Environment, which comes out with their State of Environment report every year, has shown that almost every day of the year, there was one climate hazard or extreme weather event happening in one part of the country or the other. It could be a landslide, could be a flood, it could be extreme heat. Now, climate change actually exacerbates existing health risks and introduces new health risks. So if you look at the kind of things that happen from extreme weather events, obviously leading to migration and displacement, so on. If you have a flood, repeated kind of extreme weather events, people do have to leave that place. Increasing incidence of heat waves. We'll talk about changes in vector distribution. So this is impacting diseases like dengue and chikungunya and also malaria. Then you have the air pollution, we'll talk about a bit more. But also we have to remember that apart from humans, all of this is also impacting animals and the health of the ecosystem. Now, if you think about climate and its impact on people, you have to think about three different aspects. The first one, of course, are these events which occur. The second is your vulnerability. So if you look at the bottom, you will see that there are a number of factors which determine your particular vulnerability, your age, your gender, where are you located geographically, what is your socio-economic status, what is the socio-political environment in terms of policies and systems, what is your health status, access to healthcare, and what is the biological environment in terms of agriculture, livestock, etc. So these are vulnerability factors. And then the third is exposure. How much do you get exposed? So not everybody is equally impacted by climate change, which is again an important thing to remember. So like COVID, it tends to exacerbate and widen inequalities and also the resource and time poverty. So because there's going to be more competition over land and water in particular, it can affect food production and drive up hunger, forces people to move, increases poverty inequalities, and increases security risk for women and girls. Now, again, when we talk about climate, there are certain terms that you will hear. For example, climate change drivers. Now, these are the things which have been responsible for the greenhouse gas emissions, starting with the energy sector, of course, fossil fuel use, deforestation and land use changes. It's a huge contributor, actually, but again, it continues because human beings are requiring more and more land for themselves. Agricultural practices like, the way that livestock is reared or the way that rice is cultivated. Waste management, again, we under-recognize that, the burning of waste or the poor waste management practices, landfills, etc., can be a big source of methane and other short-lived climate pollutants. Transport, of course, is one of the major contributors, and industrial production. So these are the drivers, and so these are the sectors in which action is needed for mitigation. So if you look at the square below that, on mitigation, you'll see that on the energy sector, we're going for clean and renewable energy. And of course, India is expanding this very rapidly. Afforestation and green infrastructure rather than converting land into buildings, going for sustainable or what's known as climate resilient or climate smart agricultural practices, better waste management, carbon pricing, and improving the public transportation, reducing the number of cars on the road, and then the new technologies which can enable carbon capture and storage. That's quite a lot of R&D happening in this space. Now, the effects of climate change, which you see on the top right-hand corner, is, of course, the increase in global temperatures, changes in precipitation, and ocean acidification. I mentioned sea level rise. In fact, the sea level is rising faster than, again, it was predicted the cryosphere is shrinking and soil biodiversity has gone down significantly, again, because of our agricultural practices. And then you have the adaptation, which is very important for us. So far, the world has been focusing on mitigation. And there are many global commitments. Now, more recently, there are adaptation is getting more emphasis, though still the funding for adaptation is relatively less, but there is now Global Center for Adaptation, some funds being raised, and every country, including India now, has a national adaptation plan. Our plan is likely to be approved by the cabinet fairly soon. Now, these adaptation mechanisms basically help us, humans and animals, to be able to survive and thrive with the changing environment. So crop diversification, for example, so that you don't do monocropping, and then if that crop fails, then basically the farmer loses everything. Similarly, agroforestry adoption, restoring degraded ecosystems, improving irrigation efficiency, water harvesting, and building seawalls or blue-green infrastructure. Now, we talked about what happens, across the spectrum of health. But if you look at the drivers or the determinants of health right here at the bottom, and what impact it then has on the social and structural determinants of health, then in particular in the health system itself, if you have heat stress, you have decline in air quality. Of course, health staff are also impacted, supply chains are impacted, and so on. And then you end up with these health-related illnesses, both in mental and physical health. Now, take the case of heat. The body's response to heat exposure initially is that the heart starts working harder to help cool the body. So if the heart has to work harder, obviously, if you have a pre-existing health condition, then you're at risk. Prolonged UV exposure can lead to skin problems like heat rash or sunburn. Heat can also exacerbate mental health issues like stress and anxiety. Inflammation, it causes increased inflammation and immune system impairment. As the body tries to cool itself down, you get a rapid heart rate and heavy sweating. So that's what you feel initially. Then you get into dehydration, where you start feeling very dry and thirsty. And then it ends in heat stroke, when the body can no longer regulate its temperature, it's confusion, sweating and lack of sweating rather, and fainting. And this can become fatal if the core temperature is not brought down quickly. Now, what happens when temperature and humidity are both high? For example, I live in Chennai, a place where there is high humidity. Normally, the way we cool off is by sweating, because sweat evaporation removes body heat. But when the relative humidity is high, sweating can no longer be an effective mechanism, and therefore the heat index feels even warmer, and the effect on the body is different from a dry temperature. Now, this is the trend over time, where both day and night temperatures have been plotted, and you can see that the night temperatures actually are rising even faster. And this is heat-related mortality over about 20, 30 years or so, gradually going up. And this is all over the world. There's also more food insecurity. So with extreme weather events, as well as prolonged drought, more and more people are becoming food insecure. So actually the SDGs, the Sustainable Development Goals, one of the problems as to why it will be difficult to achieve is actually climate change. There is a potential earnings loss by labor sector due to heat exposure, again in different sectors like agriculture, construction, services, and manufacturing. And there are projections also on large impacts, particularly on rice and wheat because of climate change. But certain other crops like soybean yields are projected to increase. But rising CO2 also decreases the nutritional content of many food crops. Already, we know that because of our soil health not being very good, the nutritional content of many crops actually has gone down over the years. So this was a recent report that UNICEF came out with, where they looked at climate change impacts on food and nutrition security. And they found that there are certain high-risk geographies, particularly the northern and eastern states, but because they also have low adaptive capacity. So if you have a high vulnerability, but also good adaptive capacity, then that can actually get mitigated to some extent. So there's a rural disadvantage. This is all from data. They've taken NFHS data and climate data. And this work was done with the International Institute of Population Studies, and it's a very good report. So they've looked at where the vulnerabilities are. So more rural, of course, social inequalities like ST, SC, the children are impacted more. The strongest impacts of stunting and underweight were in high vulnerability zones, also anemia. And the underlying drivers of poor nutrition were poor dietary diversity, inadequate feeding practices, particularly for young children, and repeated illnesses. Now, this was something that the CEEW produced a couple of years ago, where they plotted the heat risk index and said that these districts marked in dark red were most vulnerable for heat. But I will show you another analysis that we did later where the map actually looks slightly different. But in any case, at least half of the country is highly vulnerable to heat risk. Now, let me switch gears for a moment to air pollution and health. All of you, particularly those who live around Delhi and in the Indo-Gangetic Plain, hear enough about air pollution from the media, and you know that the PM 2.5, which are the very tiny particles, are very, very harmful for health, because it's not just a question of breathing it into the lungs, but they actually go through the blood into all the organs. And this is why they cause impacts everywhere, on the heart, on the kidneys, on the brain, on diabetes, and so on. It is the largest environmental threat to human health globally, and certainly in India. It is the second leading cause of health risk after dietary risks. 2.5 billion people are still exposed to household air pollution. That's because of using biomass for cooking. And now, of course, with the LPG shortage, there's going to be more use of biomass, particularly by the poor. And so this household air pollution, again, it's an under-recognized risk factor. We talk about transport and industry being causes, or agricultural stubble burning. People often forget that biomass burning is so common, especially across North India, because people cannot afford a LPG refill, even though they may have a connection. So globally, it's shortening life expectancy by about 2.2 years, but in North, it is shortening life expectancy by 5 to 8 years. So it's really a very important cause of a health risk. And again, women are more impacted because, of course, women do the cooking. And so their exposure is even more than men who may be working outdoors. And very often you'll find that the indoor air quality is even worse than the outdoor air quality. And those of you who are more interested in knowing about this, you can look for Dr. Kalpana Balakrishnan's work on indoor air pollution that she's been doing for more than 25 years. On pregnancy outcomes, again, there's growing data, including from the THSTI in Faridabad, where they're following a cohort of pregnant women. And they have found that there is a relationship, but it's non-linear, between the PM 2.5 and outcomes like preterm birth and fetal growth restriction. That means smaller babies and more premature babies. And if the woman is exposed during the first and the third trimester, then these impacts are greater. If you have both heat and air pollution, then the combination of these two are even deadlier. This was done in California a few years ago, and the study found that on days when you have high temperature and high air pollution, the excess risk of death is about 3 times higher than for either risk alone. Now, of course, in India, we know that this problem is quite severe. It's all over India. So it's not just a question of Delhi or the neighboring. Of course, the Indo-Gangetic plain is very badly impacted. But if you look at airsheds, there are about 10 airsheds in India, and each airshed has its own vulnerabilities. Now, I am part of a global commission called Our Common Air, co-chaired with Helen Clark, with 16 commissioners from all over the world. And we have come up with a number of documents, particularly the one that you see here, which came out in April 24. It's Clean Air, a call to action. And subsequently, there were several other products which basically make an economic case for clean air and also give solutions. Dr. Shashi Tharoor has been one of the people who's been convening members of parliament for a few years now, and I've been part of those convenings trying to raise awareness among MPs. But mainly, we do have solutions. It's not that we don't, because we know what the sources of these air pollutants are. And so, of course, we've got to invest in energy efficient power generation, which we are trying to do. We are moving to renewables. We've got to improve waste management. It's very important. Public transport, improving pedestrian cycle friendly networks, more buses, if possible, electric buses, and less cars on the road. Our buildings need to be more energy efficient and more suited to our local climate. In agriculture, we, of course, should not be doing stubble burning. We need other ways of disposing the agricultural, or rather using the agricultural waste effectively. And there are many projects going around on that. And then the cooking fuel, moving to more cleaner cooking fuels. Now, I believe that we need a Swachh Vayu Abhiyan, just like we had the Swachh Bharat Abhiyan. There should be a science-led, data-driven reform, both for health, but also for economic gain. Because right now, if you look at air pollution, it's costing India anywhere between 3 to 5% of our GDP because of poor health and of course, reduced productivity. So there would be policy, procedural, and institutional reforms. We would need a new mission, which would reach acceptable air quality in 5 years. We need to move from cities approach to an airshed approach. And these would be the focuses. I mean, I showed it in the previous slide. The current program focuses mainly on PM10, which is dust control, which really is not the most impactful for our health. We have to allocate resources, and we have examples of China and many other countries around the world that have managed to clean up their air in about 5 to 8 years' time. Each reduction, 10 microgram reduction in PM 2.5, is going to give us an 8.6% reduction in all-cause mortality, and there'll be multifold returns. Private sector will have huge scope to innovate and work on clean energy, and most importantly, it will protect our most vulnerable population. So there's no doubt at all in my mind that cleaning up our air will have huge benefits for us economically as well, and I hope that we're going to move in that direction. I want to spend a few minutes showing you some data from studies that we've been doing at the MSSRF with other partners. Our first study in 2024 was a scoping study where we looked at data from all across India, and we also collected diverse expert and community insights and perspectives, and we tried to identify the gaps in literature and gaps in knowledge. Our key findings were, of course, that pregnant women, especially, they have disproportionately higher health risks, both from heat and air pollution. There was a direct correlation between natural disasters and gender-based violence, big impact on livelihoods, particularly of rural and agricultural women. Children's both health and education were being impacted because schools get closed from time to time, or children get sick and cannot attend school. We did recommend that we need more research, more data, especially integrated data frameworks, that there was much more scope for innovation to protect ourselves at the personal, household, and the community level, and that we need more decentralized planning and empowering of panchayats and local urban bodies, because ultimately the action has to be taken at that decentralized level. So just to show you some data from the analysis we did using NFHS data and climate data over the last 10 years. districts that we took all the districts of India and divided them into districts that were exposed to repeated droughts, floods, or cyclones in the last 10 years. And we looked at certain health indicators over NFHS 4 and 5. And you can see that there were many around health and maternal outcomes and anemia and so on. But what was very striking was increase in intimate partner violence. There was an increase, of course, in dropouts from minimum recommended antenatal care, but also things like girl-child marriage and underweight in women were higher. But the most striking was really this increase in intimate partner violence across different kinds of climatic hazards and also across urban and rural areas. We followed up with a study in 2025 where we actually went out and did a survey for about 3,500 women across 7 states. And we identified districts in a different way because we calculated the heat vulnerability index, which included not only the heat hazard, but also exposure and vulnerability based on socioeconomic and other factors. So we created this heat vulnerability index. This was done with, again, the Institute of Population Studies, International Institute of Population Studies in Mumbai. And we identified these high-risk districts across many states. Now, there are other places where the heat could be very high, but because they are better resources, better healthcare access, they don't fall under the dark red. Now, again, when we did these structured questionnaires as well as focus group discussions, we came across many findings where, again, it confirmed, again, from literature, there were findings from others, but these are the findings from our study. Anemia prevalence was higher in high HVI districts, underweight was higher, ANC coverage was lower, use of sanitary napkins was lower in high HVI districts. Again, hysterectomy rates, again, a very striking finding in high HVI districts, 25% compared to low HVI districts. This is in the poorest wealth quintile. So we actually divided the women into 5 quintiles based on wealth. And you can see that normally it is women who are more well off who have more hysterectomies. But even amongst the poorest women, we found that hysterectomies were higher in the high HVI districts. And we do have a lot of anecdotal evidence from media reports and so on that women who are migrating for labor very often go in for hysterectomies because they find it very difficult to access any kind of, menstrual health products as well as toilets, etc. And this is a problem we've come across. Many working women, access to toilets, access to drinking water, access to rest facilities are lacking, whether it's outdoor work or indoor work. We found, again, the experience of gender-based violence was higher in high HVI districts, and it also went up during the summer months. It is, of course, the vulnerabilities are linked with your socioeconomic status. So the poorer the infrastructure, the more the crowding, the more you of course, have an impact. Women from scheduled caste and scheduled tribe communities reported poorer outcomes across all indicators. Nearly all the respondents reported wage losses, and women belonging to the SC communities reported the highest prevalence of heat-related health impacts. Women reported mental health issues like anxiety, irritability, and sleep issues. And they also talked about heat having an impact on their interpersonal family relationships. About violence, about half of them said that the violence was more during the summer months. Now, sleep is actually a very big issue, because if you don't have good sleep at night, and if you are exposed to a lot of heat, as you know, you won't have good quality sleep, and that actually impacts both physical and mental health. I think all of us have experienced that if you have a few nights where you don't get good sleep, you're not in very good shape after that. And on long term, it actually predisposes you to non-communicable diseases. Our health systems also, we looked at health systems. We went in and interviewed our frontline health workers, and we found that they were not well prepared either. Many of the frontline providers, they did not have training or protocols to identify heat-related illnesses. Many of the facilities did not have cooling spaces or ventilation or water stations, and there were limited visible IEC tools. Also, many women did not seek care, or many relied on local pharmacists or home remedies. Now, globally, also at the last COP in Brazil, in Belém, there was a Belém Health Action Plan. As you know, it was only in COP 28 that health actually became a separate topic for discussion. For 27 COPs, health was never central to the climate change discussions globally. Finally, now it's there. And what the Belém Health Action Plans talks about is better surveillance and monitoring to address climate-related threats, evidence-based policy strategy and capacity building, and innovation, production, and digital health to meet the health needs across diverse contexts. And the basic principles, or the cross-cutting principles, are around enhancing health equity and climate justice, and leadership and governance with social participation, that is, participation of civil society in policy making. And many countries have signed up to the Belém Health Action Plan. The WHO also has an operational framework for building climate resilient and low carbon health systems. As you know, the WHO has these 6 building blocks of health systems, and around those, they have actually put in the necessary actions. For example, assessments of climate and health risks and GHG emissions, that is from health facilities. The WHO always says that if all the health facilities in the world were a country, it would be the 5th largest CO2 emitter. So there is a lot of scope for health systems also to become much more, both in terms of mitigation, but also adaptation. Then they talk about integrated risk monitoring, early warning tools, health and climate research, climate resilient and low carbon infrastructures, technologies, supply chains, then management of the environmental determinants of health that talked about air pollution, but also water, housing, and so on, climate informed health programs, climate related emergency preparedness and management, which I think India has done well. The NDMA and the state disaster management authorities have become very good at both preparedness and management of these acute extreme weather events. Sustainable climate and health financing, I think, is something which the world has been grappling with. Don't really have good solutions over here. And then climate transformative leadership and governance, and a climate smart health workforce. So finally, if we want to build a heat resilient health system, I think heat and air pollution, I would say, are 2 big challenges, apart from, of course, the other ones like floods and landslides and so on. But for heat, we need to really have a path which is gender transformative and community driven. Primary care is going to be extremely important. So we have to always start with primary health care, redesigning clinical care, building a climate-ready health workforce, weaving heat resilience into every national health program. In fact, maternal and child health program in particular needs to really look at heat and how they can make sure that their policies are ensuring that women and children are protected. Our infrastructure needs to be more and more heat resilient, particularly in those states and districts where this is going to be a problem. So we need new climate-proof blueprints for facilities. We need to make sure that equity is at the heart of everything we do, like cool roofs, community cooling centers, because those who don't have access to air conditioning, it is the government that would have to make some arrangements for these people. And of course, integrating it into our budgets and mobilizing catalytic climate finance. So I think that if we don't address these issues of climate and environment, then whatever else advances we make in our healthcare will actually not lead to the desired outcomes, because we will be constantly hit with these setbacks. And so, just like COVID was a wake up call for health systems to become more resilient to pandemic, similarly, climate shocks are going to happen in the future. They are very much part of life now. And therefore, we need to really focus our attention on building better systems with the involvement of the community, with the involvement of, uh, because human capital, I think, is somewhere that we need to focus if we really want to be a very economically developed country. Without good human capital, which means health, nutrition, and the social determinants of health are going to be extremely important. And I think less attention has been given to those factors than on actually more the delivery of therapeutic services or management of illnesses has received the majority of our attention, not so much on the prevention and health promotion side. And that's where we need to do much more now. So thank you very much, and happy to have a discussion or a Q&A session.
Thank you so much, Dr. Soumya Swaminathan. This is a very powerful presentation. You have brought in evidence not only to show us the intersection, but also to see how we can actually go ahead with designing some of the intervention. I really like the way you brought in the importance of equity in all of this response, the examples you have shared. But we have Professor Sneha Krishnan with us to share more on these reflections and have discussion with our keynote speaker. But she will also take questions. So there are a few questions. Arman, I see you have raised your hand. It would be nice if you can also type your question. So before I hand over to Sneha, I would like to briefly introduce her. Professor Sneha Krishnan is one of our full professors with the Jindal School of Public Health and Human Development. She teaches health system research, environmental health. She also heads the Center for Humanitarian Studies at our school. She has been working in the intersection of humanitarian crisis and health, both in India and in several countries in Africa. She also leads our doctoral uh, work, PhD program. So those who are interested in PhD program, they may be you can also reach out to her. So with this, I invite Professor Sneha Krishnan to have a conversation with our guest, Dr. Soumya Swaminathan.
Thank you so much. Thank you, Dr. Swaminathan. This was such a master class in not only walking us through the different ways in which climate change is affecting all of us, which is what everyone understands, but in particularly how it disproportionately affects societal groups across different gender, age. I think you also brought in an element of geographical location, aspects of caste, indigeneity. I think one of the major lessons I think all of us today would take is that while all people are affected by unhealthy environmental conditions, but somehow climate change exacerbates how people who are impoverished and socially discriminated actually face more threats related to morbidity and mortality, even displacement. I think one thing that we may also reflect on further is a lot of internal displacement that happens across India and in South Asian countries is not only due to environmental degradation but also the impacts of climate change over the years. Like the region that I've been working on in Northeast India and Bangladesh borders and India and Myanmar borders, we now see that a lot of cross-border migration is also a result of these climate as well as human conflict areas as well. So detangling those threads between conflict and climate change is one of my interest areas. I think the other reflection from your talk is also to think not just about the vulnerability of women and children in terms of air pollution or in terms of heat waves, the two enriching case studies that you've provided, but also to look at what local community based department level actions through governments can be undertaken to fight these kind of climate justice injustice that people are facing. This requires actions both at household, community, national, as well as global efforts, global level as well. There is a lot more that we could discuss about legislation. What kind of role do solidarity groups play in raising awareness and affecting change? But I would begin with the question of intersectional effects. I think you had a slide which talked about how heat stress played an important role across scheduled caste and scheduled tribe groups, and also the maps which illustrated the geographical location. But could you also overlay that in terms of what actions do different government departments, not just health, but what is the role of, I think you mentioned the disaster management authorities, the role of urban planning bodies. So the intersectoral efforts which are needed. Could you speak a bit about some of the examples, especially with heat? I think this seems to be the way forward, that there has to be conversations and coordination across these different departments. So I would ask you to begin with that, and then I'll follow up with some questions. Thank you.
Yeah, sure. So there's also a question, in the Q&A about health system program guidelines are available in India and have they been implemented? And it's linked with what you just said. So yes, we do have a lot of, on paper, there's a national program on climate change and human health. There's also state level documents which address climate and health. There are specific heat action plans at the state level, district level, and city level. I think we have something like over 200 heat action plans in India. The problem becomes the implementation, because there isn't a separate governance for this. There isn't at the national or the state level. There is usually some officer who's also supposed to look after this program. There's no separate financing or funding for it. There's no authority for this individual. So this is why I said that this has to become a part and parcel of action at the local level, whether it's a urban local body or whether it's the panchayat, because we have so many different agroecologies across India. And of course, our city problems are some different from the rural area problems. So these are all quite interlinked. As I said, both the emissions that different sectors are producing, so it needs action, but also the, for example, transport. If we change our transport systems, it will have a win-win. Both it will reduce mitigation, it will reduce CO2 emissions, it will also improve health. For example, in London, the chief transport officer was telling me that obesity is lower in London than it is in the neighboring areas of the UK. That's because a lot of people in London use public transport.
Or cycling.
Or cycling or walking. I mean, if you use public transport, you have to walk for a certain amount of distance. And because they've put in very heavy fine levies on people who want to take their cars into central London, very few people would opt for that. Most people would opt to take public transport. Those are the kind of reforms we need in our cities. Similarly, if you have more parks and green spaces, it's good for the heat effects to bring down. It's also good for health because there are more places for people to go and exercise. And it's also looking at greenery around you has been shown to have beneficial impacts on mental health. So there are actions in different sectors which need to be, including in building design and so on. We need to change our building codes. We should no longer be putting up buildings with a lot of glass, steel, and cement in our cities, because we know that they do very poorly in hot environments, and our traditional houses were so much cooler. So agricultural systems need to change. So I think it has to be like an all of government, all of society approach. where every sector recognizes that you can no longer do business as usual and that you have a responsibility to respond. For example, we build bridges and dams, and then the next rainy season it's washed away. So should we go and rebuild that dam or that bridge in the same place, or should we really think about a different approach? Maybe we have to, again, the traditional wisdom there is very important, which one doesn't always take into account. So it's modern technology plus traditional wisdom always, the combination of the two, which means, again, consultation with local people before you implement. And very often they do have good ideas for solutions. It's just that policies are often made top down without these consultations. So when we had these consultations with women's groups from across India, it was very eye-opening, actually, the kind of stories that they came with. And the fact that for them, it was really a day-to-day issue of increased drudgery, increased work, and problems even in access to water, access to nutritious diet, and so on. And people from the Northeast were saying that, things are so bad, the biodiversity is going down, and the kind of foods we used to depend on are no longer available for us, again, because of so-called modern development. So it's very vast, this whole area. And of course, I spoke mainly about the health impacts, but it's interconnected. So the health impacts cannot be seen in isolation. So not only do every sector need to have a plan, but it all has to get integrated. So let's see what this national adaptation plan actually looks like. And, if that's implemented well, then maybe it will make a difference.
Absolutely. I think it is closely intersected to another vast area and upcoming area of loss and damages, and linking it to climate finance, and then decentralizing it
Yeah.
across different departments and different scale as well. But I think picking on the thread of health and nutrition on women and children, I think there is a question which one of our faculty members, Krupali, has raised, which is about the triple burden of malnutrition. I think young children and adolescents are now facing this shift of losing the traditional diets and then
Yes.
moving towards modernization, but it can also be linked to agricultural production changes as well. There are examples of millet mission and other measures that the government takes. But in your opinion, what are the climate smart agricultural interventions that could help address this gap between traditional ways of agriculture and modern aspirations of how diet should be, and then how it affects nutrition?
Yeah, so I think this triple burden of malnutrition has been there for some time and recognized now, I think. But the root cause is the same. It is poor diets and poor dietary diversity. And now the increasing processed food, ultra-processed food in particular, and ready-to-eat food, both across urban and rural areas. So I think we have, again, an urgent need and an opportunity to address food system. And our food system transformation has to start with what we grow. So there are fundamental problems there as well in the way that our incentives are designed and so on. The monocropping, the focus on rice and wheat, what we call the forgotten foods, the more nutritious, more climate resilient foods are not getting the same support that rice and wheat are getting. So there needs to be system policy change there in the agriculture sector. And then we have these large social safety net programs, the PDS, the school meal, the Anganwadi ICDS, Poshan Abhiyan. Government has a great opportunity there to improve the nutritional content and dietary diversity. And then I think we need a massive behavioral change education program, an IEC campaign on healthier diets. The problem with a healthier diet is it's also more expensive. And so there is the issue of affordability. And therefore, this is why I think the social safety net programs, if they make a change, it will impact very large numbers of people. We also need to act on the regulatory side especially around ultra-processed foods, just like we have regulation around advertising of tobacco and alcohol, we need regulation around labeling, front of pack labeling, and we can also link pricing GST, for example. Now this year, I think they have increased the GST on high sugar food and so on. So there are ways in which one can discourage the intake of unhealthy foods, but to make healthier foods affordable is a more difficult and a longer term challenge.
And local too, perhaps, like what is locally
Absolutely.
enriching.
Yeah.
I think there is a larger debate about availability of data, looking at gender and sex disaggregated data, but also concerns about how is this affecting the coping strategies of other vulnerable groups such as queer and trans people who anyways are blindsided by the health system. So in terms of, I think, data itself, Arman was trying to get about understand how lack of this HRI data, health resilience, I'm assuming, is a systemic problem, and what approach can work towards understanding and documenting this intersectoral, sectional kind of impacts of health as well. Where do we begin?
Yeah, so I think data is very important, and there is a lack of good quality data, I think, which is representative and which is gender disaggregated, including third genders. So we need to strengthen that. If we have that, good health data, at least from a few representative places in India, then you can start looking at the impacts of different risk factors or different variables from the climate and environment side. But without that solid health data, it's very difficult to do any kind of analysis. So this is a very big roadblock for us. And I know that, we're moving towards electronic health records, HMIS, and so on, but still the quality of the data is not so good. So we need to work with state governments, I think. And it's an iterative process. And in that, we need to ensure that it is gender disaggregated, not just male and female, but other genders as well. Only then can we really try to go into these more granularities.
Thank you. I think maybe a larger reflection for all of us who've been working in this is not only looking at vulnerability, but also looking at India's advantage as having this traditional ways of living with floods, cyclones, extreme droughts, but also this young population that we have access to who are passionate about effects of environment and understanding of how climate is impacting everyone. I wanted to get a sense of optimism from you, Dr. Swaminathan, because having worked in this field for decades, it feels like I am already hoping that the next generation will take up the mantle. What would you say is the direction for them in not just like during the COPs, but also beyond that? What action can they take up on? Because otherwise, climate awareness and climate justice issues that they are interested in seem very distant from the social realities and environmental realities of India itself. So, what would your message be to most of them who are attending this today?
So I think that we should be optimistic, and it is only through collaborative work of people across different disciplines that we can begin to throw more light on some of these quite complex issues. And while the biomedical effects, can be studied relatively easily, I would say, but studying it in the context of where people are located and what their unique vulnerabilities are, that will help to inform the solutions. So, for example, I've been talking to a lot of women in different occupations, and to understand more about what their needs are. Women garment workers, for example, women salt pan workers, or fisher women. And similarly, I think for the trans and queer group, they have already a lot of challenges. So we need data where economists and climate modelers and epidemiologists and nutritionists could actually come together to really think about these problems and how to study them, but also think through solutions, of course. So I think more research and more qualitative research in particular is going to be very helpful. I mean, that we see a lot of very good reports now, even by journalists, environmental journalists, who are reporting on many of these issues. And then, of course, we need to convert that into some policy relevant guidance and framework. So ultimately, it has to lead to policy change. And that is often a long and slow process, but the more evidence we can build, the more likely it is that that ultimately will happen. So it also requires that discussion with policymakers and so on. But even if a couple of states go in that direction of wanting to make those changes, which many states are actually doing now, whether it's agriculture or in health, and then some success from that will enable scale up. So it's not something that obviously happens overnight. Policy change never does. But I think it is now recognized as a serious enough challenge and now we see the energy crisis that we're having to face. Similarly, a food and nutrition security crisis and the climate crisis. I think these three things together will maybe an opportune moment to actually change course and do things a little bit differently. So I would say that, yeah, for young people, I think it could seem very daunting and frustrating, but I think that change happens when you have enough of a momentum built up, and that needs to be backed up by strong science and data.
Absolutely. I think one of the questions that we had received during registration was asking about how the war is going to affect maternal and child health, but it's also having an impact on the environment. And like you rightly raised, it is going to have a global impact, as we are already witnessing.
Yeah.
But maybe that can also be a triggering point to affect some kind of change as well. And the more questions people start asking and finding connections with, the more conversations that can elicit. Our Dean, Professor Stephen Marks, has raised a question, which is, do single-use plastics have any specific impacts on women and children? And what policy changes are needed to address this grave source of cellular damage, cancer, cardiovascular diseases, and reproductive health?
So I'm not aware of specifically the literature on single-use plastics and women's health. We know that it has a huge range of health impacts, as you've described. I presume that men and women, but in women particularly, we know that the endocrine disrupting chemicals can have very severe impacts on women's productive health and menstrual health and metabolic health outcomes. And I believe that the microplastics that arise from the vast use of single-use plastics that are now in our food chain are having definitely an impact on increasing the risk of many metabolic diseases and possibly cancer as well. So one would have to look at the literature to see if there are specific papers addressing this, but certainly it is very, very concerning.
Yeah, I think Professor Anika is mentioning that fertilizer plants are already getting shut off because of the war. So it may have a major impact on food prices. And I think even plastic food packaging and other industries will also take a direct hit if we start. I think the questions would keep on coming,
Yeah.
and it's a masterclass, and it's such a vast topic. I am feeling like we should have you again, Dr. Swaminathan. But this has been so enriching for not only students who are debating and trying to tackle two difficult domains of environment and health, both which are so vast in itself, but also to look at the interconnectedness between these two different disciplines over time. So, the looking at the longitudinal and temporal effects would also need that kind of intersectoral conversations as well. So, I think that would be my takeaway from your talk today. And I think, yeah, like your call for action in terms of conversations is something that should encourage all our students to keep having and speaking to different people that they interact and not be on their mobile phones all the time. But on that note, thank you very much. I would now hand it over to Professor Azad to do the final congrats. Thank you so much.
Thank you so much, Sneha and Dr. Soumya Swaminathan. This is really a masterclass. I agree with Sneha. We learned a lot, and on behalf of our school, we are very thankful to you for your time and the insights you share with us. Um, uh, we have few questions regarding the program we run, MSc Global Health and Human Development. Ma'am, I know that you have another appointment, so if you
Yes, if you don't mind, maybe I will leave now and you can carry on. Thank you so
So
much,
much.
Sneha and others, yeah, for the opportunity.
See you
so
soon. Bye.
thank
Happy
you,
to
thank you.
connect. Okay, bye
Biz-
bye.
Bye. Vijay, if you could please share a bit about the program and the admissions and details. Some participants have interest on that, as you have seen in the comment as well.
First of all, thank you everybody for joining. And for those of you who wish to explore this domain further, uh, we are offering the MSc in Global Health and Human Development Master's degree from OP Jindal Global University, and keeping the upcoming batch commencing this September 2025. I have shared the program link in the chat for your reference, and I really encourage all of you to go through visit this link, go feed on more details and explore. So there are dedicated counselors, Mr. Shahrukh, Ms. Surbi, and Mr. Sajid, who is ready to connect, understand your profile first, understand what exactly are you looking for, what value you have to had a degree. And it's a very small application followed by an SOP and interview with our faculty members, where you also get an opportunity to sit with the faculty and understand, not just to scan your profile and see whether you're a right fit, but in fact ask questions directly that about your expectations about the program, and can really this degree add value. And then if you're shortlisted, we will be taking it ahead. I think we are successfully completed with two cohorts with global learners, not just Indian. More of the audience is attracted internationally.
Thank you, Vijay. I want to stress on Vijay's one point that we actually take the interview very, very seriously. We uh, even our senior faculty members, including our dean, sometimes interacts with the prospective students. Our vice dean Nandita Van regularly interacts. So, if you are exploring, feel free. We will be very happy to have this conversation. Thank you, Vijay, for sharing this. I am also thankful to my other colleagues. Professor Rama has been very supportive in organizing this webinars. Professor Nandita Van is always supporting us with every detail. Our other colleagues, Priyambada and everyone in the school. We are a very small school, but very energetic group of people working together. Um, I also want to take this opportunity to invite you to our next webinar. In the month of April, we will have next webinar. This time, we will try to take it forward from the discussion we had today. We will try to focus on gender and nutrition in next webinar. I will, in fact, like, our team will share the more details on the next webinar in upcoming days. With this, I would like to conclude the session. Thank you so much.